Remove the implanted components, being careful to preserve as much bone stock as possible. Once components are removed, with the knee in flexion, begin tibia preparation for MBT revision. Use the tibial reamer depth chart in combination with the MBT revision reamers to prepare the tibial canal to the appropriate depth. Progressively ream until cortical chatter is achieved, being sure to stop on an even diameter reamer. With the appropriate size stem trial assembled to the cemented MBT revision tapered reamer, ream to the planned proximal tibial resection level. Assemble the appropriate size stem trial to the smallest tibial broach and impact into the tibia until the top surface of the broach is at the desired proximal tibial resection level. Sequentially broach until the broach is rotationally stable in the canal. Remove the broach handle, leaving the broach in the canal. The proximal resection may be made off of the broach, or assemble the MBT tibial broach adapter with the IM tibial referencing device and 0-degree tibial cutting block and attach to the broach. Pin the cutting block. Remove the IM referencing device and the tibial broach adapter. Resect the proximal tibia. Remove the pins and remove the cutting block. Utilize the tibial view plate to assess tibial size. Assemble the tibial tray trial with the appropriate size sleeve trial followed by the stem extension trial. Position the tibial trial construct into the prepared tibial canal. The base plate should be positioned to provide the best coverage of the tibial condylar surface. Utilize the keel punch to aid in fully seating the trial. Assemble the extension shim to the HP Revision MBT spacer blocks and perform an initial assessment of both the extension and flexion gaps. Enter the femoral medullary canal 2 to 3 mm medial to the midline of the trochlea, 7 mm to 10 mm anterior to the origin of the femoral medullary canal using a 9 mm drill to a depth of 3 to 5 cm. Use the femoral reamer depth chart in combination with the MBT revision reamers to prepare the femoral canal to the appropriate depth. Progressively ream until cortical chatter is achieved, being sure to stop on an even diameter reamer. Assemble the removable shaft to the sleeve reamer and the appropriate size stem trial. Sink the reamer assembly until the 20, 31 or 34 mm mark corresponds with the planned level of distal resection. The 20, 31 or 34 mm line sets the initial depth to correspond with the first 3 femoral sleeve sizes. Assemble the stem trial to the smallest femoral broach. Ensure that the medial marking on the broach handle is facing medially and impact into the femur until the TC3 line on the broach handle is at the planned level of distal resection. Sequentially broach until the broach is rotationally stable in the canal. Remove the broach handle, leaving the broach in the canal. Assemble the removable shaft into the broach. Slide the distal femoral alignment guide over the removable shaft. Set the valgus angle to 5 degrees left or right, respectively, and turn the blue tab to lock the setting. Assemble the distal femoral connector to the distal femoral resection guide by turning the dial from the padlock symbol clockwise to the number of the planned level of resection. Assemble the revision distal cutting block onto the distal femoral block attachment. The tang of the connector will slide into the 0 mm cutting slot on the cutting block. Assemble the resection guide to the distal femoral alignment guide until the distal cutting block touches the anterior femur. Pin the cutting block. Use a thumb and index finger to release the distal cutting block connector from the cutting block. Slide the femoral resection guide upward on the alignment guide legs until clear of the block, and then pull the femoral alignment guide distally over the removable shaft. Make the appropriate medial and lateral distal resections. Remove the pins and cutting block. Determine the appropriate femoral size by aligning the femoral trial to the distal surface of the femur. The ml width of the trial should provide the femoral size. The ml width of the trial is the same as the revision 4-in-1 cutting block. If a distal augment was prepared for in the distal resection, the distal spacer should be assembled to the corresponding side of the revision 4-in-1 cutting block by sliding it in from the side. The removable handles may be assembled to the revision 4-in-1 cutting block. Set the block to the correct AP starting position by inserting the HP revision screwdriver into the hex head on the block, push and turn to adjust. Prior to pinning, this same motion may be repeated during the procedure to adjust the placement of the block. Additionally, be certain that the correct left or right L or R setting is facing to the top on the knob. Slide the block onto the removable shaft with the appropriate L or R orientation on top. Use the HP Revision MBT spacer blocks to set the rotation of the revision 4-in-1 cutting block. Alignment rods may be introduced through the handle of the spacer block to aid in assessing alignment. With rotation and gap balancing confirmed, secure the cutting block with the HP removable headed pins through the convergent pinholes on the side. The pins will pass through the block and then through the distal spacer as shown. Remove the spacer block and removable handles. Make the anterior, posterior, anterior chamfer and posterior chamfer resections. Posterior augment resections, if necessary, will be made at this time. Remove the fixation pins and the revision 4-in-1 cutting block. Be sure to remove any bone resections from the prepared surface. Assemble the appropriate notch guide bushing, left or right and +2, 0, -2, to the appropriate size revision notch guide. For proper assembly of the bushing, the correct marking designation will be facing up, here depicted as R +2 mm. Lock into place by rotating the tabs anteriorly to the stop. If distal augments were prepared for, slide the distal spacer into the corresponding side of the revision notch guide. Slide the notch guide onto the removable shaft and advance to the prepared distal surface. The HP Revision MBT spacer block may be used to assist in re-establishing the rotation of the notch guide. Pin the notch guide using non-headed pins. Remove the notch bushing and the removable shaft assembly from the canal. Make the notch resection. The TC3 box cut is made through the proximal surface of the anterior notch guide through the slot. Remove the pins, the notch guide and the resected bone. Remove the broach assembly from the canal. Assemble the femoral trial by selecting the appropriate size femoral trial and box trial components. Place the two posterior outrigger tabs of the box trial into the recesses of the posterior condyles of the femoral trial. Rotate the box trial so that it comes into contact with the anterior flange and the adapter trial is pointing away from the distal surface. Use the HP Revision screwdriver to tighten the hex screw at the posterior of the box trial until a click is heard from the screwdriver. Adjust the box trial adapter orientation to the appropriate L or R and +2, 0, -2 settings by lifting and rotating or translating. The L or R will be facing posterior when the appropriate left or right setting is selected. Assemble the appropriate stem trial to the end of the appropriate femoral sleeve trial. Assemble the femoral sleeve trial construct onto the femoral adapter trial. Pass the sleeve bolt trial through the hole in the distal box of the femoral trial and tighten using the HP revision screwdriver. Assemble the appropriate trial augments. Seat the femoral trial assembly on the femur. Utilize the femoral impactor to fully seat the femoral trial component. Impact the keel punch. Utilize the cemented keel punch if a cement mantle is desired, or the press-fit keel punch if line-to-line contact is desired. Leave the keel punch in place for trial reduction and introduce the insert trial. Assess patellar thickness. Make the appropriate patellar resection. Position the patellar template that most adequately covers the prepared surface along the horizontal axis of the patella and firmly engage. Drill the 3 holes for the fixation pegs of the component. Enlist the proper cleansing and cementation technique. Apply cement to the prepared patellar bone. Introduce the patellar implant to the prepared bone and utilize the patellar clamp to stabilize the implant while cement is curing. For MBT revision tibial implant assembly, unscrew and remove the polyethylene cap from the end of the tibial tray. Assemble the tibial sleeve implant to the tibial tray, ensuring the tibial sleeve orientation matches the prepared canal. Use the sleeve impactor and a mallet to impact the sleeve onto the MBT revision tray. Attach the appropriately sized stem extension implant to the tray implant using the 2 wrenches to tighten and ensure full engagement. Enlist the proper cleansing and cementation technique. Perforate the prepared proximal tibia with small drill holes to facilitate penetration of bone cement. When a fluted stem with a metaphyseal sleeve is used, ensure the medullary canal remains free of cement. Seat the tibial implant construct into the prepared tibia by impacting with the RP tray impactor and universal handle assembly. For assembly of the sigma knee femoral components with the femoral adapter, select the correct femoral component size and the correct femoral adapter and bolt that correspond to the position selected with the revision 4-in-1 cutting block. Pass the bolt through the hole of the femoral component and assemble into the sigma knee femoral adapter positioned on the top of the box. Attach the sigma knee femoral adapter holding clamp to the femoral implant and the sigma knee femoral adapter torque wrench to the sigma knee femoral adapter implant and move clockwise to tighten the adapter. The torque wrench deflection beam must reach the appropriate 270 inch-pound mark. Attach the appropriate femoral augments using the wobble bits included in the augment package. Assemble using the augment T-handle provided. Assemble the appropriate stem extension to the femoral sleeve implant using the 2 wrenches to tighten and ensure full engagement. Place the assembled sleeve and stem construct on top of the femoral adapter assembly, ensuring that the medial side of the sleeve is pointing medially. Use the femoral trial construct to help set the final sleeve and femur implant rotation. Utilize the femoral stem and sleeve impactor and a mallet to engage the 2 constructs. Apply bone cement to the posterior condyles of the femoral component prior to introducing to the prepared femur. Bone cement should be applied to the prepared femoral bone surfaces, including the anterior chamfer, distal and posterior chamfer, prior to introducing the final implant. Implant the femoral component using the femoral impactor. A final trial with the implants in place may be done by utilizing the revision trial post set into the implanted MBT revision tibial implant and utilizing the appropriate insert trial. Fully extend the knee to maintain pressure as the cement polymerizes. Once the cement has polymerized, remove the insert trial. Introduce the final insert implant.